Hello, my name is Alexis Petty, and I will be the nurse assisting you today throughout your procedure. I know any procedure can make you nervous, but I'm here to ensure you that the procedure will go smoothly and you have nothing to worry about. So, the goal of the Mohs surgery is to clear skin cancer. We do this also by achieving the smallest scar and preserving the maximum amount of normal tissue. So, we don't take too much out, we take the right amount to make sure that there is no cancer left behind. So today, with your case, we are removing basal cell carcinoma, which is the most common form of skin cancer. In the event of basal cell carcinoma, there is a growth in the basal cells, which is the deepest layer of the epidermis, which is your skin. Basal cell carcinoma is often characterized by having the appearance of an open sore, red patches, pink growths, shiny bumps, or scars. And today, the person performing your surgery will be Dr. Jasmine Harris, MD. She's a dermatologist that has been trained in the Mohs surgery technique. So now I'm going to kind of take you step by step through the procedure that will be happening today. So first, the surgeon will mark the incision or scarring where they will start the procedure. So right here, she'll mark with a marker to outline where she would like to, kind of start. Then she'll place local anesthesia around the area to make sure that it's all numbed up. Once the numbing agent has taken effect, the surgeon will use a scalpel to biopsy a thin visible layer of cancer tissue. And what that means is she's just going to go in, cut out a piece of the skin. You will be numb, so you won't feel it, I promise. And biopsy that, which means look at it under a microscope to see if there are any cancer cells on it. So after she takes the first layer of cancer tissue, you'll be bandaged and sent to the waiting room. While in the waiting room, the surgeon will examine the tissue taken under a microscope and map out where any cancer remains along the edges of the sample. So what we're doing is we're taking out piece by piece and we're marking the edges. If there's still cancer on the edges, that means we need to go back in and cut out a bigger portion. Then the surgeon will repeat this until the edges of the tissue sample are clear of cancer. So that means that there are no cancer cells left behind, and that the doctor has gotten all of it. And throughout this time, the numbing agent should not wear off, but if it does, you will be administered more numbing agent, so that way the procedure will not be uncomfortable for you. Now, a lot of people ask how long this procedure will take. The procedure is actually very lengthy. Instead of people, the Mohs surgery technique is very different from other techniques where you get sent home after you get your first biopsy. With this one, you stay in the waiting room, and after the first layer of tissue is examined, you're taken back in. So it can take maybe anywhere from an hour to 5 hours. It just depends on how much cancer there is and how much has to be removed, to ensure that all the cancer you are cancer free by the time that you leave. So the more rounds of biopsying and looking at it under a microscope we have to do, the longer it will take. And a lot of people ask about the after effects of any type of surgery like this. Since it is the cutting away of skin, there will always be a risk of scarring. But the surgeons are trained in reconstruction of the skin, which aids in decreasing the chance of scarring. If the amount of tissue that must be removed is significant, there may be need to have a skin flap or a skin graft, which with time will heal also. It won't look like your normal skin, but it will look more normal than it had been during the healing process. And because there will be an open wound on your skin, you need to ensure that you are taking proper care to ensure that infection does not set in or it doesn't lead to increased complications and even more surgery. So please make sure to follow the discharge instructions we will present you with after the surgery has taken place. And these are the instructions that have been formulated to ensure that the best healing process takes place for all of our patients. And then also after the surgery, we need to schedule a follow-up to remove the stitches and check on your healing process. And then you can meet with the receptionist to determine what date best fits your schedule. Any questions?